Hello everyone, welcome to another session of my video. In today's video, I want to talk about a very important medical topic, that is hepatitis. Now, many people don't take hepatitis for a serious thing, but today I want us to have a quick discussion about what hepatitis is, what it does to our liver, and how we can prevent and treat it if the disease occurs. So basically, hepatitis is inflammation of the liver, but there's quite some number of causes of hepatitis. But today we'll focus on viral hepatitis. Now, viral hepatitis is inflammation of the liver caused by invasion of virus on the liver tissues. Okay, so we have a number of type of hepatitis and how each of them is being affected by different type of viruses. Okay, so we will focus on hepatitis A for now. We will run through all the types of hepatitis if time is on our side. But in this video, I will focus more on hepatitis A. Okay, so before we go through the issues of hepatitis A, I would love to talk about the function of the liver. You see, the liver helps us in our daily activities by reducing toxins and all the chemicals in our blood. It also helps us to fight against infection by producing the minute substance that help us to fight our infections when we get them. And these example of these things are globulins and other things. They help us to fight against infection, and the liver also help us to digest certain food substances like the fats that bile play a role in it, which is also produced by the liver. So if I want to go on and on and on, I can mention a lot of functions of the liver that plays vital role in activity of other organs. Yes, so when the liver is affected, it's really a big deal. So you need to make it a serious point to treat it or to see your doctor. All right. So with hepatitis, we have about 4 or 5 types of hepatitis. We have hepatitis A, B, C, D, E, and but for the purpose of this series, I will talk about hepatitis A up to hepatitis E. So now, what is hepatitis A? Hepatitis A is not as serious as other type of hepatitis. Basically, hepatitis A is caused by hepatitis A virus. And looking at the epidemiology of the hepatitis A, it accounts for about 20 to 25% of all the clinical cases of hepatitis. So you see that it's almost about 30%, and it's really not kind of common, but in some certain part of the world, example, the USA, about 30% of all clinical cases of hepatitis A is the most dominant case in hepatitis. Yes. Yeah. So that is that. And mostly children do not really develop antibodies for hepatitis A. So it affects children in severe form. And so when children have hepatitis A, it's mostly severe. Yes. So let's talk about the transmission of hepatitis A. Mostly hepatitis A is transmitted through orophycal method. So when I say orophycal method, it means that you get it either through food contaminated by hepatitis A virus or through water contaminated by hepatitis A virus. And these things run into the GIT and comes down into our feces and then recycle into food or water. So that is what it means. And mostly people living in unhygienic places or poor sanitation. In fact, research has shown that and children get hepatitis through school playgrounds and poor sanitations around environment, and then sometimes they get it through play when they are playing. Yes, so it's likely that children will contact hepatitis A virus, so they are very vulnerable. So you need to be aware of that. And then people also living in poor sewage disposal areas that the water bodies are being polluted, they are being dumped. It's in those areas, it's likely that you get hepatitis A from those areas because food and water are mostly contaminated in that manner. Okay. So now the incubation period of hepatitis A virus is around 2 to 4 weeks, but in a mean aggregate is exactly a month or 4 weeks. So we put it that way. And mostly the active phase of the condition, when the condition is actively engaging, it can be prolonged up to 2 to 8 weeks or 4 to 8 weeks in some books. Yeah. So when you have the hepatitis A virus, it can be prolonged, and then the disease condition can continue up to 8 weeks or 4 weeks. Yes. So you'll be in that clinical stage for that prolonged time or period. And also, the mortality rate for hepatitis A is relatively low compared to other types of hepatitis A. So you see, in adults that are older than 40 years and above, mortality rate is less than 0.5 or approximately 0.5. So it means that when you take 10 people who are having, who are older and having hepatitis A, it's almost certain that none of them will die. Yes, that is how mild the condition is. And also for children, they have a mortality rate of around 1 to 2%. So it means that when you have children and that are 10 children that are sick of Hep A, it's likely that 1 or 2 child may die. Yeah, so that is the mortality rate for hepatitis A. And then there are some instances that changes the mortality rate, especially when whether you are adult or a child and you have other underlying chronic conditions. Yeah, it's likely that you have a higher mortality rate or higher morbidity rate for that matter. Yeah, so that is the differences in that. And then it is very important for us to know that there is no progression in hepatitis A. When you have hepatitis A, it does not progress to the chronic stage or the carrier stage. So it's always subside in the acute phase. Yes, that is one thing that we have to know about the hepatitis A. And then after you have the infection, you develop immunity against the infection. Yes, so you have immunity after you have obtained the condition and it's been resolved. You have immunity against the hepatitis A virus. Okay, so let's look at the clinical symptoms of hepatitis A. Mostly it begins with initial symptoms, and sometimes you become asymptomatic for a period of 2 weeks up to 4 weeks. So you not even have symptoms. And if that is not so, when you begin to have symptoms, mostly the initial symptoms are always a flu-like symptoms, like you have flu or upper respiratory symptoms, like catarrh. You have those catarrh, you have nasal discharges, and then you begin to have difficulty in breathing. Sometimes they are very mild, right? Yes. So that is how they happen. And ultimately, the in the initial phase, you also develop low-grade fever. So the fever in that stage is really a low-grade one, and it's not really a severe form of fever. So the disease will progress, and then the signs and symptoms will also progress to a different stage. So you begin to have jaundice in the ecteric phase. Yeah, so to have jaundice. Yes. At that time, you have other gastrointestinal symptoms like fractures and heartburns and the rest. Yes. So that one, it should tell you that you have the disease has progressed to an advanced stage. Yes. Yes. So that is that for the signs and symptoms. And then we can also, when the signs and symptoms also sustain for a long period of time, after 10 to 12 days, it begins to subside. It begins to subside. Yes. At that time, the patient or the person with the virus will tend to have aversion for odor. The person will begin to love more unregular type of odor, like cigarette scent, the scent from smoke of cigarette and those things. And that time, the jaundice will begin to subside. Yes. So that is that for the clinical stage. So between that stage and to about 14 to 28 days, the symptoms will subside, and if the immune system is strong, the body will start to get rid of the the virus from your body. Yes. And then let's talk about how to diagnose the condition. So basically, the way to diagnose this condition is by having done some tests. You see, but the physical examination that is most likely for you to know you have the Hep A viruses. The first one is there is a mild enlargement of the liver when you palpate it, or the spleen. So we call it a mild splenomegaly or a mild hepatomegaly. So you realize that when you palpate the spleen or the liver is quite or is mildly enlarged, and sometimes it's even painful. So that is one physical examination. And another one is jaundice. So you realize that some part of the patient or the person with the virus, you see the person is etheric. See, jaundice. You check the conjunctiva and then the skin and the palm. You realize that it is yellowish. So that is another way to be able to find out. That's another physical examination to go by. And then we can also talk about the tests, where we do at the labs. Yes. So we can do the antigen test. Yes. Basically, antigen is mostly present few days after you have the infection in the serum. Yeah, so when you do the test, it is likely that it will be detected. Sometimes it's even detectable 10 days before the initial occurrence of signs and symptoms. So it is likely that tests will give you accurate results for diagnosis of hepatitis A. And also we can also do antibody test. Yes, antibody test to be able to rule out the hepatitis A virus. So that is basically what we do to be able to diagnose hepatitis, right? So let's see how the management goes. Basically, we don't use drugs in management of hepatitis A. And if the person is old enough, the person will be able to get rid of the virus easily. But if the person is a child, sometimes it takes quite some time. Or if there is a comorbid condition or underlying chronic condition, it makes it much more difficult. So basically that is that. But for the management, bed rest is a key factor. And you make sure that the patient is having active rest after intermittent activities. So the person will have to rest well. And also you have to give supporting diet. The diet of the patients to support if there is protein deficiency or whatsoever, you need to make sure you replenish it appropriately. And that will help to recovery, yes, in the recovery process. And you also put in place of parental nutrition if it is necessary, especially during the last stage of the signs and symptoms. There's always either anorexia, and you have to always make sure to manage that. If there is total anorexia, parental nutrition is very necessary, and that will help the patient. So you give fluids and then glucose to help maximize energy for proper recovery. And then the other one that I will talk about is the patient should be able to be ambulating whilst at bed rest to prevent any bed rest related conditions like bed sores and all that. So gradual ambulation is also a key in the recovery of the patient. And since drugs are not mostly used in management of this condition, this medical or nursing engagement is very important to prevent any additional condition. Yes. So that is what we do to, and with the prevention of hepatitis A is simple. Mostly there should be proper hand washing. The sanitation should always be good. And we should also dispose our sewage properly. Yes, proper sewage disposal is also important. And we can always go for a vaccine. Hepatitis A is having vaccine. So when you are not being exposed to the virus before, you can always get yourself vaccinated. And if you're also exposed to the virus or you have it, within 2 weeks, you can also go for immunoglobulin shots. Yes, so globulin shots helps to maximize the immunoglobulin. It maximizes the antibodies to fight against the condition. So it makes the condition a subclinical case. So it doesn't advance into, it's likely that you don't even see the signs and symptoms when you go in for the advanced treatment like that. So it is very important for us to be aware of how hepatitis A can affect our daily life. In the next video, I will talk about hepatitis B up to hepatitis D or E if time is there. So, and thanks for watching and look forward for our next video. Bye bye.